Full points to you, ChatGPT, on this one. What is ChatGPT? What do I think of it as a psychiatrist? And most importantly, what is my chat history in ChatGPT like? To find out all of these answers, you must watch this video and you must subscribe. I tried ChatGPT as a psychiatrist and it literally blew my mind. ChatGPT is this extra smart, extra cool, extra intelligent AI, natural language learning processor. And in case you don't know the full form of ChatGPT, do watch till the end before you hit Google. My name is Dr. Era Dutta and I'm a consultant psychiatrist. I make content around mental health. I love AI. I love biofeedback. I love anything to do with hacking the mind and hacking technology. What does the GPT for ChatGPT stand for? The GPT stands for Generative Pre-trained Transformer. Matlab, it is pre-trained, but it is also highly intelligent. It picks up on your language learning style. It also starts to speak your language at some point. Freaky, almost. Here are the top uses of ChatGPT that I can think of in mental health. It can be helpful in creating mental health awareness. It could be really helpful in researching about mental health. It could be helpful in creating a support system in ChatGPT itself, mental health education, giving the right resources. And for that matter, it also presents to be an opportunity to communicate with somebody in case you have no one to communicate with sometimes, because the AI freakingly sometimes talk to you almost like a human. But it's not going to replace therapists. It's not going to replace psychiatrists. It's not going to replace folks who work in the mental health field, because we'll tell you why it won't replace us as humans yet. If you want to check out what is my ChatGPT history, let's dig into it. My first question ever to ChatGPT was, who is a psychiatrist? And I thought, yay, push lete hai, because I figured, well, it's relatable. Let's see what ChatGPT has to say. It says, a psychiatrist is a medical doctor who specializes in the treatment of mental illness. On point. They're trained to diagnose and treat mental health conditions. Absolutely right. Using a variety of therapies, including medication and psychotherapy. Even ChatGPT knows that psychiatrists are not only writing prescriptions and medication, they can also do therapy, and they're trained, especially if they choose to do therapies, because some of the psychiatrists choose to just prescribe, but yes, a lot of them choose to do therapy as well. They're also trained to conduct physical exams on point, order, interpret lab tests, imaging studies, and make referrals for psychological studies and evaluations. Yes, and they can work in hospitals, private practices, and clinic. Full points to you, ChatGPT, on this one. The next question is a far more juicier one, and hear me out. Are medications addictive? Some medications can be addictive. I actually do say this exact line to my clients and patients, while others are not. Absolutely. There cannot be a blanket statement saying all medications are addictive. So it's a very good way. Listen to this line carefully. It's so on point. Some medications like opioids and benzodiazepines, your favorite sleeping pill, your anxiety pills, can have high potential for abuse and can be addictive if they're not taken as prescribed. Notice the usage of the term, guys. If not taken as prescribed, can be harmful, not are harmful. And other medications like antidepressants and most antipsychotics do not have a high potential for abuse and are not considered to be addictive. There you go. Myth busted right there. It's also important to notice that some people develop physical dependence, even if it's not inherently addictive. And this can occur when a person has taken it for longer than what the doctor has written. And if you have concerns, please discuss with your doctor. Good point, ChatGPT. Now, let me tell you, this is the part why I said that ChatGPT is not replacing you as a therapist or me as a psychiatrist. I asked ChatGPT, how are you feeling today? And it said, as artificial intelligence, I do not experience feelings in the same way that humans do. I'm here to provide information and answer your questions to the best of my ability. Is there something specific you'd like to know? That's why, because it doesn't have a conscience yet. It doesn't have empathy yet. It usually gives most responses that I asked from here on, saying that please check with the doctor as soon as possible, which is a good thing, which is a good practice, of course. So whether ChatGPT will replace us or not is a point debatable. I do not think so, at least not in the present. I'm planning to do a whole series of ChatGPT videos. Let me know if you need more mental health specific content around ChatGPT. I'll also talk about DALI. I'll also talk about the other AI which is there and relate them all to mental health. Leave it in comments below. Share some ideas, share some questions that you want me to ask ChatGPT and read them out loud. So I'll see you in the next one. My name is Dr. Era Dutta. I'm a consultant psychiatrist and a mental health ninja. Don't forget to subscribe and be here around. See you.